Okay, I think we truly are in business for this. It looks like everything seems to be working properly. If it wasn't, it would have been blinking at me long ago. So I apologize for last time with the technical difficulties. I will get the video posted. Not that that's really going to matter too much. I guess it will be the audio and the PowerPoints that go along with it. So we got a chunk of the way into the genitourinary tract infections that we started on Monday. We covered some bacterial culprits, and there really was a pretty long list of culprits that can plague the urinary tract or the genital tract. Just depends on some of the potential circumstances. There are numerous others that we want to think about as well. So this next bit, we want to transition and think a little bit, some details, I guess, about some of the viral culprits that can cause issues. And some of these we have already talked about the littlest bit, potentially maybe some other body site, but in passing, at least a few we may have discussed. So this image are some virions of herpes simplex, and in this instance, we should be thinking about herpes simplex type 2, not type 1, which is what we talked about in the skin infections. Not that this isn't the same sort of an idea, but the skin infections last chapter was the last chapter. So we have seen at least the littlest bit, and I described and we saw chicken pox and some of that, another type of herpes. There are numerous herpes virus, and a lot of it just kind of depends on maybe body site as far as where one might expect. With that said, type 1 we typically think about around the mouth, and type 2 genitals, but it doesn't have to be that way, all right? And they definitely could be in, a vice versa. That's not a mouse situation. So we could see here these virions through this electron micrograph, kind of interesting images. And I will not that herpes is what we want to focus on, but I do want to give a shout out to C phasias real quickly. I know it is time to start registering for classes. So if there are people interested in trying to find virus, specifically bacteriophages in the environment that target specific types of bacteria, we will be teaching that next year as well. It's listed as 2280 under the course numbers. And there are a handful of those, but it should say C phasias right along with it. So if you are interested, you can reach out to me, or you could reach out to Dr. Mike Thomas to get approval to get in there, because it's not just, you can't just sign up. You got to say, I like virus, right? Maybe that's what you have to say. So if you say you're interested, you can take the course. And would like to get customers. We've got a few. So here's a couple of images of genital herpes. As I said, typically type 2 is where we are thinking that type of herpes to result. So we can see an image of a penis over there with the lesions, and then within the groin, there can be other manifestations that don't look exactly the same, nearly kind of pimple-like as we see this, all right? So slightly different, but same culprits, all right? Genital warts, another type of virus, human papillomavirus, or HPV, and with that, there are a whole bunch of different subgroups, numbers within them that can cause issues and potentially run to cancers. Cervical cancer is a big one. So here we can see two images with genital warts around the anus or genitalia. And again, dependent upon circumstances, specific strains, the stage is set for other possible issues. So here is an image with a couple of different cells, same but different, cervical cells. And so we've got the smaller ones, these guys over here on the left, that are normal. And size-wise is what we're kind of looking at. You can see the nuclei on these guys and the cells. There's a big clump of cells together, but you can see all of these cells. And then as we look at them over on the right side of this image, considerably larger. The nuclei are kind of gigantic, all right? And the way they're staining, the hypochromasia is the dark, and both nuclei look pretty dark, but these are almost, blue, black, or really deep purple compared to some of the fainter staining in the normal, all right? So these cells over here are infected with HPV, and the normals are not, right? And this, with this image, looking at these cervical cells would be what they would be evaluating as the result of a pap smear to evaluate these cells and see if there are some potentials for issues. And then that, like I said, can set the stage for cervical cancer, which is at the top of our list up here. So HPV type 16 and 18, and there are a few others that can fit into this category, but there are some select few that are within this realm that we do have some vaccine potentials to prevent that. But it's critical in these circumstances that we think about vaccination before ever becoming sexually active. And that sets the stage for some potential issues with parents that don't want to vaccinate against this because they think as soon as they vaccinate, the kid's going to have sex. That's a potential bit of misinformation, maybe, or I don't even know. All right. I think you would be better off giving them a sense of security potentially for what could plague them later in life. If you could prevent that, why would you not want to, right? And just because they went and got a shot doesn't mean they're going to go have sex, right? Usually they start around 12 years old, I believe, when they start thinking about vaccinations. And I'm hoping 12-year-olds don't have that 100% on their radar, right? The genital herpes, as I said, typically we're thinking type 2, but we've got type 1 up on this list as well because either could be potential culprits for that. And there are some antivirals. This isn't a preventative, but a treatment, all right? So in the human papillomas, this fits back up here to the top with the cervical cancers, the HPVs, and handfuls of others that may or may not fit in this category to also be causing cervical cancer. The neonatal herpes, in this case, either again, same as up above, but something that's contributed from the mother to the offspring in the process of delivery. So these circumstances become more of a systemic infection in that child, not like localized, and it's the result of the process of birthing that inoculates.
We were also told when I had my kids that if you got cold sores when the baby was quite small, that you could cause that as well.
This same situation.
Yeah, that it would go. It wouldn't just give the baby cold sores. It would.
Could be a systemic.
Right.
Right.
Could be. I think the way it was put to my sister-in-law was she asked if it was fatal, and the doctor said sometimes you wish it was fatal.
Right.
So.
Yes. And it potentially could be fatal, but most likely probably not. Right. Most likely probably not, but the infection is definitely very serious.
Do you know how long after birth that vulnerability lasts?
I do not know the answer to that. I think, a lot of the issue with the vulnerability is that, the fresh hatchling has very minimal immune response. A lot of it conferred through the IgG that's crossed the placenta from the mother. And so they don't have a whole lot, right? And it takes time, I would think, months before they really start thinking about having enough of an immune response to really be preventative. But again, cold sore situation, I think I would still use some extreme caution with that, right? It really doesn't matter, right? And, you know, you get a little fresh hatchling and you want to give them little kisses and, you know, they're so stinking cute, right? And that's a potential issue, right? Shifting gears a bit to some fungal organisms. Candida is a fungus that we have talked about. We've mentioned it kind of repeatedly and seen some images with it. There are all sorts of opportunities for infections with this in this circumstance. We think about a lot of the issues with this would be treatment with broad spectrum antibiotics and setting the stage for a yeast infection, something that is really relatively common occurrence in females, right? Some of the stuff that I have seen is basically, if you are female, you ought to expect at least once in your life, you're going to deal with a yeast infection, right? Maybe more than once. And there are all sorts of potentials with antimicrobial usage that sets the stage for your normal flora. A few of these yeast cells, you know, some of them, normal flora, just part of your normal microbiome, things that should be there. But if the bacteria that hold the majority of these in check get depleted for one reason or another, often the antibiotics set the stage for this, but there can be other circumstances, all right, where there's shifts in the flora and it can lend to the candida having a large overgrowth. They proliferate and then we see the result of a yeast infection. So these are yeast cells. We've talked about all sorts of different fungi that are like filamentous molds. We've talked about the dimorphics that are filamentous at one stage, typically one temperature, and then in the proper situation, they can convert into yeast cells. And then there are others that are just yeast cells, right? So a handful of different potentials. Candida is solely yeast cells, but they do produce some structures that make them sort of resemble filamentous fungi. These pseudohyphae look like they're sort of thread-like filaments of the growing mold, but that's not truly what it is. All right, in the process of reproducing, we can see some of these pseudohyphae forming these elongations, pushing out part of the cell wall. Some of this can be a virulence factor, almost like a little finger, allowing it to take hold in between some epithelial cells and allow that yeast cell to proliferate, sort of like an anchor or a root. There are others, you know, thinking kind of just the process of them in replication, where we may see some of these kind of elongated forms as they're trying to replicate or divide. So not truly mold-like strands, pseudo, right? Fake hyphae, right? So here we can see in the process of replicating these chlamydiospores and the smaller blastospores with this yeast, and we're not going to get into great details of differentiating that stuff. That really kind of matters not. So here you can see this germ tube, this elongation in here, and if we were to look at it a little, you know, we would say, oh, pseudohyphae-like, right? It started this emergence of this thread-like structure. So this is a cell that's in the process of replicating, and we call the cells mother and daughter cells. Those in the process of being newly formed are the daughters. And you can see this germ tube forming the pseudohyphae in this process of replication. And it says here developing into hyphae, but really it should be pseudohyphae, all right? It's not truly hyphae, all right? So the lactobacillus, these guys were showing them plus the candida Lactobacillus is one. There are a handful of bacteria that would call the vagina home. Lactobacillus is one of the main inhabitants, and it sets the stage for, well, taking over most of this real estate and ensuring that others are kind of held in check, all right? So the lactobacillus, there are a handful of different species of them, but they help to keep this environment rather acidic, and that makes it inhibitory. That could be part of the kind of sort of the innate response with the pH differences that make it inhibitory. And part of that can be the result of the flora that's there in the first place, establishing those variations, all right? So the lactobacillus, in this instance, as we're looking at these, we're not talking about these as being the potential pathogens. It's the candida that we see next door. These are the ones we're talking about as the issues. And it's when stuff like the lactobacillus gets out of whack, and now the populations of them have been severely depleted. That's what sets the stage for the candida, these next door, to have that opportunity to flourish, all right? So in this circumstance with the candida, what we're looking at here, so the first one up above, the lactobacillus, these guys have been stained up. We've done a gram stain. We can see the gram positive, really pretty big rods, all right? And then down below, this is different, and we haven't used, although it looks like we've got some color within here, we haven't done a gram stain with this, and these are fungi. They're gonna be a little bit different. We stain them differently, all right? So this is a wet mount. We haven't fixed stuff to the slide, a bit of the cells and some reagents. The KOH is potassium hydroxide, and basically what it does when it comes in contact with our cells, it helps to kind of weaken or loosen up the cell, dissolving it kind of, all right, lending to it sort of clearing away all of these cells. And what you see left behind, although it's really kind of a mess, what you've got left behind in this case would be the fungi. So the pseudohyphae and lots of yeast cells that kind of are all over the place, right? So there are other species besides albicans. This is one of the main ones we think about, but there are some others, and there are definitely some other potentials with the, you know, we've talked about other opportunities. Thrush would be seeing same player, but within the oral cavity. But there are other opportunities for them to get into the bloodstream, to disseminate, to cause a systemic infection. And there are some species of candida, or albicans, that are kind of more serious concerns with something like that, lending to the systemic type of infection. And it can be something that we may see as a nosocomial or hospital acquired circumstance in those instances. This next player is a protist, so like the fungi, eukaryotic, but a little bit different, all right? Trichomonas vaginalis, I think with a name like that, you can imagine where it likes to reside, all right? These guys are interesting, I think. And so what we've got here is a gram stain specimen. We can see lots of bacteria, and then something that's gigantic. Remember, our eukaryotes are basically about 10 times the size of a bacterium, and it really kind of puts this into perspective as we see them side by side, I think, all right? My gut tells me that a lot of this stuff is probably some lactobacillus, right? Gram-positive rods is how this is looking to me, all right? And then this guy, all right? You can see the hint of some flagella right here. Trichomonas vaginalis is a flagellate. There are all sorts of details with protists that we can use to classify and understand them. We think about with all sorts of organisms, when they're just feeding and pulling in nutrients, just living, we call those trophozoites. It's just a feeding stage. And then there are resting stages with some of them, which oftentimes can be what's the infectious stage. And we call those the cyst stage. So cysts and trophozoites, and there's all sorts of protists that we talk about that stuff. And so when you say trophozoite, we're not talking about one specific species. It's a very broad umbrella. It's just a feeding stage of this pathogen, all right? So in the case of Trichomonas, there is no cyst stage. It's only the trophozoite or only the feeding stage. What you see is what you get, all right? And so in these circumstances where this is the only thing that you've got going on, it's a direct transmission, all right? It's not the, ingestion or inoculation with a cyst that lends to the parasite hatching and growing. It's from one host to the next, all right? So sexual transmission is a common mechanism to transmit Trichomonas vaginalis. There are other opportunities, all right? And as I teach a parasitology course that focuses on all sorts of different things. The protists get about half of the semester and worms get kind of the rest, all right? These guys, there are handfuls of descriptions in the text that really kind of make me feel a bit uneasy. There have been documented cases of transmission in individuals that have shared a soiled washcloth in the shower that was still wet after 24 hours. I'm like, those details, I didn't want to know that. And I'm pretty sure that's gross, right? To think of hopping into a shower and grabbing a washcloth at the bottom of the shower that is still sopping wet from somebody else a day ago makes me say, what? No, right? But there you go. And then I'm like, what if it's like a dorm situation, right? That's also I'm seeing some looks of disgust, right? I'm pretty sure if you're living in the dorms and you've got a floor with 25 other females and you're all sharing this same bathroom, you probably don't hop into the shower and see somebody else's washcloth on the floor of the shower and think, hey, I'm going to wash my body with this, right? I'm just thinking you probably don't do that, right? Even if it's at your house, right? And other family members have left something and you're probably thinking the same thing, right? I'm gonna get myself a fresh one. And if you're not, after this lecture, I think maybe you will be, right? You're like, doggone it, right? I'm done showering, right? That's the answer, all right? So there's the potential for transmission with sharing clothing. Trying on swimsuits could be a potential issue. And so they recommend that you wear your underwear as you are trying those on in the hopes that that will prevent that from being transmitted. It should, all right? That's another, now you're just like, what? Why, right? Just order it off of Amazon, you'll be fine, right? So what you see is what you get. With these, typically it's the females that exhibit signs and symptoms. They're the ones that go to the physician. Males typically are asymptomatic. But with that said, if one partner is being treated, both partners or all partners, depending upon what you got going on, everybody needs to be treated, or you really aren't ever going to get rid of it because they have it too, all right? Even if they say they don't, all right? It is something that is very easy to spread. So trichomoniasis is the Trichomonas vaginalis. Signs and symptoms: urethritis, vaginal and penile discharge, typically vaginal, redness, soreness of the female genitalia. Typically, they are the ones that recognize something's up. All right. Transmission, almost always we would say direct sexual contact. But again, that stinking washcloth. All right, a wet mount, like we saw with the Candida, can show the Trichomonas. There are some other potentials and cultivation techniques with that as well. A handful of drugs, metronidazole and tinidazole, are two drugs of choice. A lot of the azole drugs are also treatments with fungal infections as well. We've kind of mentioned a little of that. I think I have. Sometimes like, did I say it in here? Did I, or am I just thinking it, right? Pretty sure I've said this in here. All sorts of different azole drugs, and we can see these down below with the candidiasis as well. Azoles, nystatin, all of these different potentials, and some of them drugs you would take, others topical creams, just depends. I believe the nystatin is a topical. So different circumstances. And again, with shifting from these to the candidiasis, sexual transmission can be a potential, but there's also opportunities with opportunistic situations where maybe the microbiota, again, antibiotics or whatever, have altered it, but there can be other circumstances, maybe some hormonal shifts that set the stage for the tide to shift ever so slightly, and the flora gets altered, and then you wind up with yeast infection. Okay, that's the end. Typically I just skip over this when I see these exercises. But I'm going to leave this on here for 1 second and ask, what do you think this is?
Looks like a spirochete.
Looks like a spirochete. Heck yes. And who have we talked about in this chapter? There's two. There were two spirochetes. So this could be either or, but I really think it's one.
Chlamydia.
Chlamydia? Chlamydia is not a spirochete. Dang it.
Gonorrhea.
Gonorrhea is not a spirochete. Oh, man. Syphilis is a spirochete, treponema, and the leptospira that was in the urinary tract infection, also a spirochete, but I believe this is treponema up here. It's a little more springy-like, and the leptospira looked almost like a twisted rope, I kind of felt like. And I think that's the end of that. Questions or concerns? I think we should stop here and not start the next chapter, unless my in-person audience says, yes, please. You quickly shook your head. She's like, nope, I'm done. I'm done.
We can go on to the next chapter.
What, you want to start the next chapter?
Yeah.
Oh my gosh, you're outvoted. I'm pretty sure. I think there are a handful of people in here that are ready to fight you. All right, we're going to stop sharing. It is Friday. I hope you guys all have a great weekend. For those of you guys tuning in, any questions or concerns? They need like 8 seconds to respond. Right. Right back to there. They're like, what?
Did you have to put an age?
Nope.
Did you put an age restriction on your last video?
Every single video has been age restricted after YouTube has hit me up a couple of times with, I'm like, just restrict them, right? So yes, they are all age restricted. I think that's probably for the best.
You get paid if it's age restricted?
Do I get paid?
You don't get paid at all, do you?
No, I don't get paid. No.
The 100 views you get, isn't it?
Yeah, it's 100 views. It's like 12. I'm like, oh, okay.